Welcome to the Health Admin Life podcast. My name is Brooke, and I'm going to interview special guests to explore the vast career opportunities in health administration. Whether you're a clinical professional, a corporate worker, a student, or a patient yourself, this podcast is for everyone. Get ready to be inspired. Hello, current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I'd like to welcome Charles Bryce, Home Health, Hospice, and Personal Care Non-Skilled CEO for Charlotte Health Services. Charles, can you tell me a little bit more about who you are?
Oh, yeah. So thanks, Brooke, for having me. So my name is Charles. I'm a former D1 athlete, a clinician by trade, went to physical therapy school, and now I oversee a healthcare company here in Dallas. I got two kids. One is 3 and the other one's 5. And my wife, we've been married for almost 9 years now. So really busy. I love what I do. Healthcare is crazy, and I always wanted to be specifically a clinician. Never really saw myself in business. I love being at the bedside, and stumbled upon this about since in 2016, and just now I'm doing leadership and not clinical bedside anymore. So, but it's fun. I love it. It's a lot of work, but it's fun.
That's wonderful. And I'm glad you were able to find this route. And I think a lot of our listeners would love to know exactly what your position entails. I know you're going into something a little different than most people, especially with your own company.
Yeah. So for me, I think the route it was really unconventional. So I went to school as a therapist. Then I worked at a hospital, regional hospital, for a while, and this position came up, and I was like, not sure if I really want to do this, but I really kind of understood that you can still take care of people, but now you just have to take care of people from a higher level and make sure everyone's taking care of patients. And so it's not like a really traditional role. It's a little bit different. So this specific company, it's a family-owned, faith-based. They've been around for about 20 years. And I used to work every once in a while in high school when I was here in Dallas. I used to shred paper. So I just got to know the company for a while. And over the course of several years, just got to know them. And so I went to college. They were like, hey, there's a clinical administrator position open. I think you would be a great fit. And I was like, well, I'm not sure. And so interviewed and got the job. And so, I mean, that's really what it is. It was a God thing, if I want to say it like that. So, and for me, it was a challenge going from taking care of patients and having just a couple of I had health information background was my minor, so I had HIM was my minor, but mostly it was all clinicals. And so being able to now be thrown into a financial world, going through regulations, understanding compliance, monitoring cash flow from insurances, and combating with Medicare, and trying to figure out all these things. It was a lot. And so, but it took a while, but I love it. And you're not your normal conventional role, but it's if you're built for it, you can really help a lot of people and do a great job. So.
That's fantastic. And I think having that clinical background can help diversify your perspective and can relate to other clinicians, help relate to patients and other staff more, which is great. Another question specifically with the company is, how did you get started in home health, or how did that company begin?
Yeah, so back in the 90s, my mom and a few people kind of got together and said they wanted to start a business that specifically was tailored towards not selling. So the climate back then and even now is that a lot of home health and hospices will build up and then they'll sell because it can be really lucrative. Unfortunately, when that happens, the culture changes, the care changes, and a lot of times you have someone who's coming in probably not from the same area or same city, and they're kind of enforcing, business ideals, which is good, but it's not tailored to the community, and so it kind of takes back and it hurts the patient. So she wanted to start something where it was a legacy company, so where basically someone who was in administration would have clinical background, they would be trained, and it's a trust so that it could not be sold, which is nice. And so very, very different. It allows for stability in our clinicians. It allows for stability and our patience, knowing that as long as I have breath, I'm gonna be running it, and then the next person that's gonna be after me is gonna they're gonna have the training. They're gonna have to be a clinician. They're gonna have to understand the core values of our company, and then we have kind of like a Supreme Court, like a board that's like, okay, this is the next person that's gonna take over, and it's just healthy, and so very different, very, but it is a beautiful thing. So that's kind of how I got started.
That's wonderful, and I appreciate you sharing that awesome
Yep,
story. And with this, you're in the long-term care sector, correct?
correct, yes.
And I think a lot of people don't necessarily know like the different realms within. Can you
Yeah.
explain those a little more?
Yes, so there's so many different areas of healthcare, that you've got, pediatric, right, which is younger than 18 years old. Then you've got adult in general. Then you've got, pharmacology. You've got different areas. The long-term care is really focusing on the geriatric population. Geriatric, it ranges. It's usually anywhere between 45 and older. Medicare looks at the geriatric population at age 65. And once you hit 65, you qualified for Medicare services, and you go from there all the way until end of life. And so when you're looking at long-term care, it's really focusing on, okay, what is it? How do I care for this person from that kind of age 45 and moving forward, and really project and figure out ways to take care of that case mix or that population. So it's really focused on Medicare, geriatric. You've probably heard of geriatrics, really adult care, older adult care. And so there's a lot of terms, but long term, when you really think about that, it's just planning to take care of you as you age long term. So
Good to know. And can you explain the difference between palliative care and hospice?
yes, yeah, that's a great question. There's like so many differences between the two. So I'll break down kind of the two things that I usually like to kind of liken it to. So palliative care, the word palliative care is really about an approach, a way of taking care of someone, and so that approach is really long term, making sure that they're comfortable. And so you're trying to figure out, how do I tailor to the needs of that person? So let's just say, give an example. Say, for instance, you've got an aunt, right, who is maybe 70 years old, and unfortunately, they got diagnosed with cancer, right? So there's two ways you could care for your aunt. You could either say, okay, we want to go the chemo route, we want to fight, we want to do whatever we can, and that's where palliative care would come in, right? To come in and say, okay, let's figure out a way to keep them comfortable, not too much pain, and keep them going on chemo and move forward. So it's an approach. Hospice care means, okay, we've kind of got it to where you probably not only have 6 months or less to live based on how the disease is treating your body. And then hospice comes in and says, okay, we're not going to use chemo anymore. We've kind of exhausted everything we can. Let's try to figure out a way to keep you comfortable. So let's bring you home. What are your wishes? Okay, you want to hang out with your nieces and nephews more. Okay, let's get them over here. Let's hang out. Okay, now we got a nurse that's coming in consistently to kind of manage and help you through this process. So it's a different approach, and so
Right.
yeah, it's beautiful. It's hard, but it is good at the same time. So
Thank you for sharing. How long have you been in the industry for?
so I graduated in 2013, and then I went straight into the hospital system to work on the physical therapy floor, ortho. So since 2013, as a clinician, did that for a few years. But as an administrator, it's going to be year 7. So
Great. And
already, it's
what,
crazy.
I know, time sure does fly.
Mhm.
And what, I guess, both sides, what made you interested in being a clinician? And then what made you transition, or what made you interested in going into more like the administrator side?
Yeah, that's a great question. So when I was in high school, I'll go back to high school. Um, I love sports, love soccer. I played soccer in high school. Then um, I was like trying to figure out, what do I want to do in college. I was like, I love sports. Don't want to be a doctor because it's a long, a lot of school. And I was like, not sure if I want to do all that. So I found a program that focused on therapy, physical therapy. And I was like, well, I could do sports and do that. So I took care of my grandpa also when I was in high school, and I had a passion for the geriatric population just because it's my grandpa. He always taught me a lot of wise things, and he was a diabetic, so I would help him with his blood sugars in the morning, then go to school, right, and then come back, check his blood
Mhm.
sugars at night before I went to bed. And so it just became like a routine, and I just was like, oh, this is actually kind of cool. So um, went to school, went to college, played soccer there, did physical therapy, and then I was like, I kind of want to keep going towards the geriatric route. I mean, I've done sports my whole life, and I was like, I feel like I mean, I love old people. I don't know why. I just think it's fun. And
Mhm.
um, so I started doing that, and then met my wife while she was a nurse. I was a PT. She had a passion for the geriatric population, and I did too. And that kind of took us from there. And then we started working at a hospital once I graduated together. So she was a nurse on the floor, and I was a therapist on the floor. And we just started taking care of people with knees and hips problems and surgeries. And that's kind of how it started on the clinical side. Um, the admin side, I really stumbled upon it. Like, I was actually really and truly, I was going to the doctorate program of my physical therapy and wanted to keep going. And I, did my GRE, did everything after as a practicing clinician and tried to apply, and I didn't get into those programs. I was like, man, what's going on? And then that opportunity opened up in Dallas for that clinical administrator. And I was like, I asked my wife, and she's like, hey, what do you think? And she was like, go ahead, try. Like, I mean, we can go to from St. Louis, go to Dallas and start a family, and then it's a great place to live, and that's how we got started. Uh, very, very. I mean, it was truly. I went from because back then I think like what I was like 28, I guess 27, and overseeing like people who were like two times my age, three times my age. I mean, I'm very insecure. I was like, man, I don't know what I'm doing. I just know I know clinicals really well. So
Mhm.
really humbling. A lot to learn. Had good mentors around me to kind of help me along the way. But very, very different when you're going from clinicals straight to healthcare admin. So any advice I could offer people, would love to help. So
I think it's great to really see how one door closed, but you took that opportunity when one door opened
yeah,
and you didn't necessarily give up. And I think that's the beauty of healthcare. There's so many different
yep,
opportunities. Um, and both sides can be so rewarding and ultimately impact patients, whether you're helping them directly or indirectly, which is
right.
nice.
I
Another
agree.
question I had is you mentioned working with a spouse, and I've met a few people that have done that in healthcare, and I
Yeah,
find it more common than I really thought it would be. Do you
yeah.
have any advice working with a spouse or work life balance or
Oh
both?
yeah, yeah, definitely. So it's funny because like not everybody can work with their spouse, to be honest. But for us, like that's kind of all we knew. So it was different for us. We went to school together, so we both studied in study hall together in the library annex, right? So I would say like, hey, you're studying for anatomy and physiology. I'm studying it too. Sweet, let's study together, right? So
Yeah.
it was a relationship that was built even when we were dating. So I think one of the biggest things that me and my wife have is a respect factor. So what I mean by that is healthcare is stressful, and so we both have an understanding that if we're frustrated, it's not because we're frustrated with one another at work. It's because we're frustrated with probably the situation that's happening, and then because of that, we know that we're not gonna like cause each other to be upset, right? Or take that out on each other. And so I think that's a really key piece. One of the things that we've done over the last 9 years is that every month we always take a hotel stay in the area, and so we'll say, okay, hey, let's stay at the Courtyard Marriott for $100, or let's go to the West End, and we always do that just to reset and to have one night away from the kids, and just do that because it allows us to kind of like come together and say, hey, how did the month go? How's everything going? Let's grab a bite to eat. Let's be refreshed because it's in healthcare. It's crazy. That's been a blessing for us. And we got that from a mentor of ours that was like married, that's been married for 45 years, and they've been doing that for years. And it's helped them to take care of themselves as a married couple, and then also to push the reset button every month. So we do that without fail, which helps us to be really healthy in work because we have a good outside of work, marriage.
I
So it just takes a lot of work, but intentionality behind it. So,
I love that. Thank you for sharing.
oh yeah.
Next question I would say is, what is your favorite thing about working in healthcare?
Hmm. Uh, I think, man, I love talking to patients. Um, I love being able to say there's a problem, and our team has looked at the problem, addressed the problem, and found an outcome and a solution. And then hearing the patient afterwards saying, "Oh my gosh, thank you so much for your help. Thank you for, being a great company that I could trust." And I think because we do home health and hospice, it's a knee replacement or hip replacement. They had surgery. They were really scared and freaked out before surgery. And our team educated them on pre-op. Did a great job from nursing and therapy all the way through. And at the end, they discharged and graduated from home health. And I pick up the phone and call them and say, hey, you're done. We probably won't see you again. And then they're excited. So those are things that I love to hear. At end of life, it's a little bit different. It's them, the families being scared of hospice and us walking them through it, and then helping them slowly progress and say, hey, this is normal, this is normal. And then that loved one pass away. And then they call after and say, thank you for being here with me through this turbulent time. And it was such a great experience. So I think those are the joys that really, to me, make the pain of healthcare really sweet. So
And I would say you really are not only changing lives, but at the same time, I would say saving lives, because you're not just helping the patient into a second life or wherever they're going, but you're helping the families. So I think
yeah,
that's really important.
yeah, I
Um,
agree.
for the next question, do you have any insights for aspiring leaders going into health admin?
Yes. One of the things that we kind of mentioned before is it does when you have never been at the bedside with a patient. Um, it depends on the area, right? We talked about this earlier. It depends on the area of healthcare that you're going into, right? So, if you're going into healthcare management for billing and remittances, right, you may never see a patient, right? But the thing is that if you can shadow a nurse or shadow in a nursing facility and just get interaction with a patient and understand that everything that you're doing, literally everything you're doing, whether it's the back office authorizations for claims or stocking supplies, right, in a warehouse, everything is meant for that patient. And so I would advise high schoolers, anyone who's in college or master's programs, if you've never shadowed, and there's nursing homes down the street everywhere, you can literally go
Yes,
by and say,
100%.
hey, stop by and say, hey, you know what, I'm going to shadow at least 4 hours each week and just get to know, let me sit with Miss Betty in room 205 and just talk with her, right? And, or it could be on the flip side. You go to a pediatric clinic, right? And I would say just figure out ways to be at the bedside, because you have to realize that's what healthcare is all about. It was meant for patients. And whether you're in any realm of healthcare administration, you cannot detach yourself from that, because
No.
that's what it's all about. So,
And that made me think of a story. And
yeah.
during COVID, I actually volunteered at a nursing home. I wrote letters for patients there, but I came in contact, my specific um, patient. She was 102,
Oh, yeah, that's
and
awesome.
it was awesome. She couldn't leave her room, but at least I could write her every week. She technically lived in my neighborhood. I just couldn't go see her. So at least that was a small way I could help and volunteer and give
Yeah.
back. And it helped me see another side of healthcare that I haven't been exposed to. So it was really cool. Even though I didn't specifically shadow, I got that opportunity to connect on a different way. And
Yeah.
I stress to people, if you have the opportunity to volunteer, whether it's at your local nursing home, local hospital,
Yep.
even just any capacity, this
Yep.
can really get your foot in the door. Because
Yep.
I could have, if I really wanted to, I could have asked for a job there because they
Hmm.
were really familiar with me.
Hmm.
Um, and not only that, you can also find your passion or gain a better understanding or appreciation
Right.
for the industry and staff.
Right. 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 I agree. Because like one of the biggest things is like if you say, okay, I want to do this specific realm of healthcare, and you don't actually go and volunteer or shadow and be in there, it's like, oh wow, this is great. Then like you don't know, you may be down the road getting your master's, and then you're going into like, oh my gosh, I never really wanted to do this, right? And so
Exactly. Yeah,
like if you're able to do that on the front end, then I agree, it helps totally, it helps so much.
exactly. If there was one thing you could improve in the healthcare delivery system, what would it be?
Hmm. I think that's a really good, it's a complicated question, because so my background is so my family, I'm first generation American, and so my family's from Africa, and so like I have cousins and everyone back in Nigeria, and I see a lot of the bad stuff of healthcare, right? And so one of the things I always stress is that healthcare here is still really, really, really good compared to other places, right? I mean, that's just the truth. I mean, it's seeing from my like my cousin had a seizure in Nigeria and almost died just from a basic seizure, right, in the hospital because they didn't have enough supplies, electricity, things like that. So, I think it's also being grateful for the current system that we live in, because it is a great system. It's got its flaws like everything else, but I think it's really important to kind of keep that in perspective when you do go to different parts of the world. Um, with that said, being in this industry and understanding it for a while, I think there is I think that the payer system just has to get a little bit better, and it has to be um, done at a way that's advantageous for the patient and for the people who are caring for the patient. And so I think I would say, like, I was looking at the rates recently, and I think it's 7.1% is the inflation rate for November of 2022, and which is crazy. And so, uh,
Mhm.
I give you examples that we have a contract with United Healthcare, and great, love, thank you for the contract, but the problem is that they haven't adjusted those rates based on inflation, and so it's the same rates from 2009 today is the same
Wow.
rate. So the
Wow.
problem is that what we have to do as healthcare administrators, we have to figure out ways to create different margin, figure out, be really cost effective, because that rate has not changed in 2009, and it's just what it is. And
Mm.
so those are ways that I think there's got to be different ways to offset that, to make sure that those can be adjusted for patient care. So
Yeah, I completely agree. And I think there are so many wonderful benefits. And comparing our system to other countries, there's so many different models, whether you can say um, it's the national social XYZ model, but also looking at our fee for service and trying to transition into value based care.
yeah,
Like, what are the drivers? And it's like, okay, yes, I think insurance companies have a big say in how much take home they have and how much they're paying um, employers. But at the same time, I also look, what are the root causes? Because there's so many factors that go into it. And recently, I think this just it has been on my mind. That I learned this week that there was a $3.5 million drug called Hemgenix
hmm,
that was approved by the FDA recently for hemophilia B patients. And it's an important drug, but if the patient doesn't pay for it, insurance does. But what happens is that eventually, once that is actually paid for by insurance, it goes and dispersed to everyone. So that is something to consider moving in the future. It's like it's not sustainable. So what is the answer? And there's so many
right,
factors, but that was just something that was on my mind. Do
yeah.
you think there is a solution to this, or even in general any payer models or any suggestions?
Yeah, so I was talking to we quarterly we meet with our all of our medical directors, and so we have like four strong medical directors that I meet with that oversee the company. And so we had like a dinner quarterly. We had a dinner and we were just talking because they're just well versed. They've been doing healthcare for years. And so I was picking their brain on that because I was just curious. And one of the things that they said was that the problem is that before, back in the 80s, doctors really had a lot of autonomy, and so they really dictated how healthcare was supposed to be done, the right way. And so what they saw was that once those payers came in, it allowed for advances in healthcare, the technology. And with those advances, it's really expensive, right? But the problem is that they kind of pushed the doctors aside and kind of use more of non-clinical judgments to kind of move and push forward in terms of payer mixes and things like that. And so they were saying, as the doctors union, I think it's AMA, and they were saying that it hasn't allowed them to have a voice as much, and so because of that, there's disparity in healthcare, and also them not getting paid as much by the insurances. So I was just talking, I was like, man, that makes a lot of sense, and I think really and truly there just has to be um, avenues for voices to speak up, right?
Mm-hmm.
So nurses to speak up more, and that's the beautiful thing about social media and just even this podcast. It's just awareness, right? So by me having that conversation with our doctors, I was like, oh my gosh, I had no idea. Like, this is what all doctors are going through. They're not getting paid enough. They're not, in the 80s, they were making a whole bunch because they were the ones that could kind of dictate, but not in a bad way, but figure out the way to do it. But now, I was talking to one of our internal medicine doctors. They were like, for me to get reimbursed, for me to take care of this patient, I have to see, back in the day, I used to only have to see two people and get paid enough. Now they have to see 10 people, like just to get enough revenue to meet the
Mm-hmm.
cost of what it was in the past of just two patients. So that's why you see that doctors are running through things because they're not able to slow down and take care of those patients. So one of the doctors were saying that they flipped over to a concierge medicine practice because now the patient would pay cash, like a retainer fee, and say, "Hey, I'm gonna pay you, I don't know, $150 a month. This is just an estimate, right?" Now you have time, and now the doctor can spend more time with that patient, and they don't have to worry about doing those things. So there's so many different ways, but
Yeah,
I
there
really do think
is.
it's just awareness. So
And I agree. I think it's awareness, it's education, and it's highlighting things like there's so many people in the US that don't have healthcare insurance. And then once they go to the ER, they can't afford it. Then the hospital has to pay it. Then that could also run up insurance premiums, XYZ in the long term. And there's no easy answers. There really aren't,
mm,
because
mm,
now that even if you have insurance, you can't necessarily use it because it's so expensive and your
yep,
deductibles, your co-pays, co-insurance. So
yep,
I hope there's a solution sooner than later. But
yep.
before ending the podcast, I just want to say this has been wonderful. And I thank you so much for being a guest
All
speaker.
right.
Is there a way that listeners can stay connected with you after the show, Charles?
Yeah, sure. I tried to do TikTok, and I just started doing that recently. It's Chats with Charles, and I just talk about my experience as a healthcare administrator, things that we've talked about. So you could look up Chats with Charles on TikTok and Instagram and YouTube. And yeah, I think the biggest thing, like we just talked about, is just the awareness, just educating, empowering the next generation of healthcare administrators, healthcare workers to be passionate about what they do, because that's how change can happen. Is if the next generation is really passionate about figuring out a way to help patients and change the system, that's the only way it can happen. So
I completely agree. And on that note, I want to thank everyone for listening. Today's show is brought to you by our sponsors, Riverside and Anchor by Spotify. To listen to more episodes, check out the link in my bio at Health Admin Life on TikTok, Instagram, or YouTube.